Hi everyone, welcome back to our channel Nursing Bars K. Today, day 4 of the revision of the NORCET SGPGI and KGMU most important MCQ. Let's start. A 60-year-old patient present with sudden chest pain radiating to the left arm. ECG shows ST elevation in leads 2, 3 and AVF. What is the most likely diagnosis? Option A, anterior wall MI. Option B, inferior wall MI. Option C, lateral wall MI. Option D, posterior wall MI. The answer is option B, inferior wall MI. Because ST elevations leads 2, 3 and AVF, it indicates the inferior wall myocardial infarction, commonly due to the right coronary artery occlusion. So the answer is option B, inferior wall MI. Next, the nurse is caring for a patient on magnesium sulfate therapy for the preeclampsia. Which finding indicates magnesium toxicity? Option A, hyperactive deep tendon reflexes. Option B, respiratory rate less than 12 per minute. Option C, increase the urine output. Option D, elevated blood pressure. The answer is option B, respiratory rate less than 12 beats per minute. Magnesium sulfate MgSO4 depress the CNS, and respiratory depression when it occurs, loss of reflexes and oliguria less than 400 ml urine indicated the toxicity. So the answer is option B, respiratory rate less than 12 per minute. Next, a patient with COPD is prescribed oxygen at 2 liter minimum via nasal cannula. Which nursing intervention is the correct? Option A, maintain the SpO2 at 88 to 92%. Option B, increase the O2 until SpO2 reaches the 100%. Use 10 liter per minute if dyspnea occurs. Option D, administer O2 only during the sleep. The answer is option A, maintain the SpO2 at 88 to 92%. Because in COPD patients, high oxygen flow can suppress the respiratory drive. Target SpO2 is 88 to 92%. So the answer is option A. Next, the nurse notes a newborn with blue lips, central cyanosis and heart murmur. Which congenital heart defect is most likely? Option A, ventricular septal defect. Option B, tetralogy of Fallot. Option C, patent ductus arteriosus. Option D, atrial septal defects. The answer is option B, tetralogy of Fallot. Because in tetralogy of Fallot causes cyanosis, due to right to left and may present with murmur. So the answer is tetralogy of Fallot. Next, during nasogastric tube insertion, NG tube insertion, the patient starts coughing and turns blue. What is the first nursing action? Option A, push the tube gently. Option B, withdraw the tube immediately. Option C, apply the oxygen. Option D, notify. Coughing and cyanosis indicates tube misplacement in the airway. Immediate withdrawal prevent the aspiration. So the answer is option B. Next, which of the fluid is appropriate for the patient with hypernatremia? Option A, 0.9% NS. Option B, 5% dextrose in water. Option C, 3% NaCl. Option D, Ringer's lactate. The answer is option B, 5% dextrose in water, because it is hypotonic and it helps lower serum sodium gradually avoiding rapid shift. So the answer is option B, 5% dextrose in water. Next, a patient with PPH, postpartum hemorrhage, is given oxytocin. Which is the primary nursing assessment? Option A, blood pressure. Option B, uterine tone and bleeding. Option C, respiratory rate. Option D, temperature. The answer is option B, uterine tone and bleeding, because oxytocin stimulate uterine contraction, and assessing uterine tone and bleeding is the critical to prevent the further hemorrhage. So the answer is option B, uterine tone and bleeding. Next, which action is priority for a patient with sudden airway obstruction due to choking? Option A, call the doctor. Option B, perform Heimlich maneuver. Option C, give water to swallow. Option D, apply the back massage. The answer is option B, perform the Heimlich maneuver. Immediate removal of obstruction via Heimlich maneuver prevents hypoxia and death. So the answer is option B, perform Heimlich maneuver. Next, a nurse is assessing a patient with diabetic ketoacidosis. Which lab value is expected? Option A, serum bicarbonate 25 mg per liter. Option B, blood glucose 500 mg per del. Option C, pH 7.45. Option D, potassium 3.0 mg per liter. The answer is option B, blood glucose 500 mg per del. in diabetic ketoacidosis, because in diabetic ketoacidosis present with the hyperglycemia. In hyperglycemia occurs when the blood glucose level is more than 250 mg per del. It's an metabolic acidosis. Low in pH and potassium disturbances. So the answer is option B. Glucose level is more than 500 mg per del is an expected in the diabetic ketoacidosis. Next, which is the most important nursing action after a patient undergoes a colostomy? Option A, change the pouch daily. Option B, assess stoma color and output. Option C, wash stoma with alcohol. Option D, apply powder to stoma. The answer is option B, assess stoma color and output, because stoma assessment ensures viability and early detection of any complications like ischemia or necrosis, ischemia or any necrosis. So the answer is option B, assess the stoma color and output. Next, a patient receiving warfarin therapy reports black tarry stools. What is the priority action? Option A, document the chart. Option B, notify physician immediately. Option C, advise patient to rest. Option D, increase the warfarin dose. The answer is option B, notify the physician immediately, because it indicates the gastrointestinal bleeding. It indicates gastrointestinal bleeding, and it is a serious adverse effect of anticoagulant. So the answer is, when it see the black tarry stool, I notify the physician immediately. So the answer will be option B. Next, a patient with acute kidney infection has potassium 6.5 millicube per liter. Which intervention is most urgent? Option A, start hemodialysis. Option B, restrict the fluids. Option C, administer potassium supplement. Option D, encourage potassium diet. The answer will be option A, start hemodialysis. Hyperkalemia, when the normal level is potassium 3.5 to 5.8 MEQ per liter. 6.5 is the indicates hyperkalemia. Hyperkalemia is a life-threatening condition. Dialysis is needed if not responding to medical management. So the answer will be option A, start hemodialysis. Thank you everyone. Please like, share and subscribe our channel.